my name is Ashley Curtis, and I am going to be performing trach care for you today. So you will need your trach care kit, your normal saline, your patient with the trach, your drape, and your sterile gloves, and your suctioning. All right, so I am going to introduce myself to the patient. Hello, my name is Ashley Curtis. Can I ask you to state your name and date of birth for me? Okay, I'm going to take my pulse. I'm going to auscultate the lungs with my stethoscope. And I'm going to now perform my hand hygiene. And I'm going to put on one glove so that I can open the container. And I'm going to separate the bins with my one glove. All right, sounds good. And I'm going to pour my solution with my ungloved hand into the container. Okay, now I'm going to put my second glove on. And again, make sure that you have sterile gloves, not disposable ones for this procedure. Now, I'm going to unlock the outer cannula and remove the inner cannula. Okay, so here's my inner cannula, and I'm going to set it over here in my sterile area. I'm going to set it in this area so I can clean it. Okay, so I'm going to clean the inner cannula remaining with my aseptic technique. And just for show, this is supposed to go inside the cannula, but it's kind of, oh, yep, it kind of works. There we go. And now I'm going to clean the inside of it. Lean in, make sure that it's all clean. Perfect. Throw that all away. Now I'm going to suction my patient, and just to let you know, if your patient is on oxygen, make sure that you increase the oxygen to 100% if you're by yourself. And if your patient is on a ventilator, make sure that you disconnect it. So I'm going to suction some of the normal saline into my suction to make sure that it is working properly. Sounds good. And make sure when you are putting the suction catheter in that you are not suctioning when you're going in. You make sure you suction once you get in it. So I'm going to place the catheter, advance the catheter until resistance is met. And I feel resistance. I'm going to pull back 1 centimeter, apply the suction while rotating and withdrawing the catheter. And now you will allow no more than 10 seconds to suction. Okay, I'm going to let out, and there might be some noises that your patient will make, like, or anything like that. That is okay. Don't freak out. This is helping them. So I'm going to clean out my suction in my normal saline, and I'm going to allow 20 to 30 seconds to make sure that my patient is comfortable. And if I believe that I need to suction again, I will suction again. So just for this sake, I have cleaned out my suction. I'm going to suction one more time. All right, it's been 10 seconds. I'm going to discard my tube. I'm going to reinsert my inner cannula. It has been dried. It has been cleaned. So I'm reinserting my inner cannula. Going to look in my outer cannula. And now I'm going to clean the outside. Make sure if there's anything. And if your strings, which the part that attaches to the neck, if it's dirty or soiled or anything, make sure you replace those. Mine for this demonstration is not dirty. And to let you know that there is a disposable inner cannula. And when you have those, you'll just throw that disposable inner cannula away. And then you will, replace it after you've suctioned everything. And after you suction, you'll make sure to listen again to the lungs. Make sure there's no secretions left or anything like that. So now I am going to remove my gloves. So I'm going to take this hand, my non-dominant hand, I'm going to take in the middle and curl it into the middle of my palm on my non-dominant hand. Then I'm going to take these two fingers and I'm going to reach on the inside of my gloves because the outside has been contaminated by secretions of somebody's body fluids, and you don't want that on your hands. All right, so I'm going to discard of my gloves into the trash container, and I am going to make sure that I have already gotten all of the stuff off my patient. Everything's in the trash, and I'm going to ask the patient if they are okay, and then I'm going to perform my hand hygiene. I'm going to make sure, hello, Miss Petunia, making sure, do you know where your call-out is? Are you comfortable with the way you're sitting? Do you need any more blankets or pillows? You're okay? All right. I'm going to step over here and I'm going to document what happened today, okay? All right. So you'll step over to your computer and you will document the procedure that was done and how well the procedure went for your patient. Like if they didn't tolerate it well, didn't want to do it, was resistant. You make sure you know what time, what date, and everything for the patient in your documentation center. And this is also to make sure that another nurse knows that it already has happened, so they don't go say, well, Miss Nurse actually didn't do it, so I better go do it now, okay? All right, so that's all I have for y'all today. Thank you.